Alrighty guys, welcome back. Now we're going to talk about the Pumani bubble CPAP machine. So generally speaking, let's talk about what CPAP is. So CPAP stands for continuous positive airway pressure. And what that means is you have a device that is providing a constant pressure of air into the patient. In this case, this is a nasal CPAP, so it's going to provide a constant pressure of air into the patient through nasal prongs. This is important because it can help the patient breathe in a number of different ways. In the upper airway, it helps prevent the tongue and some of the soft tissue from falling and obstructing the airway. And then in the lower airway, it can help to prevent the alveoli from collapsing, right? So if the alveoli don't have enough pressure in them, they can actually get shriveled up. Obviously, if they have too much pressure in them, they can rupture, so too much pressure is bad and too little pressure is bad. But CPAP specifically helps with too little pressure in the airways. So it helps to keep the alveoli open. But again, you always want to use your CPAP within the limits that is described in your protocol to make sure you don't give too much pressure to the patient and actually cause rupturing of the alveoli or potentially causing a pneumothorax. So you always want to make sure you follow the protocols. The comprehensive newborn care protocols from Kenya, released in 2022, are fantastic, and they're extremely detailed in going over how to use CPAP, everything from setting it up, testing the machine, getting the baby ready, and all the way to escalating the care, increasing the treatment, and then eventually decreasing the treatment and stopping the treatment once the baby gets better. So let's talk about our machine specifically right here. This is the Pumani bubble CPAP, and essentially it functions by taking air. It's a combination of room air that it gets from the back. There's a vent back here on the back of the machine that takes in room air, and then you also hook up supplemental oxygen, either from an oxygen concentrator, an oxygen tank, or from an outlet on the wall that has oxygen. Some hospitals have oxygen outlets on the wall, but here we use either an oxygen concentrator or an oxygen tank, and you hook the oxygen tank or concentrator up to the CPAP. So it is bringing in atmospheric air from the vents on the back. And then it is also having oxygen pumped into it through this O2 port, and it is blending those two sources of air together. And what that does is it allows you to give air to your patient that is a higher fractional percentage of oxygen, or FiO2. And you control the percentage of oxygen based off of how you mix them right here. And I'll get into that in just a second, right? But essentially we're taking nearly pure oxygen from the oxygen concentrator or oxygen tank mixed with atmospheric air from the vents on the back. It comes together and then it comes out of this port right here. And it goes through this tube, through the tube, up and out of this nose piece right here. These nasal prongs, maybe I'll hold them down here so you guys can see better. These nasal prongs. So it comes through this tube up to these nasal prongs. It can go into the patient right there. And then it's also a continuous tube into the expiratory tube. So that allows any air that doesn't go into the patient, or if the patient exhales, it also allows air to escape. So it's providing constant pressure to the patient, and then air can also keep going to the expiratory tubing, which goes from here back up through this bigger tube and over to this bottle right here. Now it's like, why is it in a water bottle? That's a good question. If you've ever had a glass of milk or a soda with a straw in it and you go to blow bubbles, like you blow bubbles into your milk or your beverage, right? It takes pressure to do that. And the deeper the straw is into the beverage, the more pressure it takes. So this water bottle is actually providing or maintaining the pressure in our system. I'm going to show you this right here. There's actually a straw in this bottle that you can see right here, right? So you have a straw in there, and then when we put it in, our water level, right? We can increase our water level or decrease our water level, and that changes how deep the straw is into this bottle, and that changes the pressure in our system, right? So it's actually called centimeters of water, and that is our pressure. So right now we're at 6, right? We're at 6 centimeters of H2O. So that is a measure of pressure. So if you want to provide more pressure, you can increase that. If you want to provide less pressure, you can remove some water, right? But this is ultimately what regulates the pressure in our continuous positive airway pressure system. Now, to blending the oxygen. I said we were going to come back to this, right? So we have some nearly pure oxygen coming from the oxygen concentrator, some atmospheric air coming from the atmosphere, right? So it gets mixed together based on how you set these two dials, right? So we have our O2 flow. So this is the flow coming from our oxygen source, and we have our total flow, right? So the overall equation is our atmospheric air in liters per minute plus our oxygen in liters per minute, right? Those two added together will then make up our total flow. So if our total flow is set at 6 and our O2 flow, as in coming from our oxygen concentrator, is set at 3, total flow of 6, oxygen makes up 3 of those liters. That means 3 liters of atmospheric air are being brought in. All right, guys, to show you an example, I have the oxygen concentrator turned on, and I also have our CPAP machine turned on, and I have my dials set here, okay? So I have it set on how the Kenya Comprehensive Newborn Care Protocols say to start the CPAP treatment, and that is with a total flow of 6 liters per minute, which is measured right here, and you always measure from the center of the ball. Not the bottom, not the top, you always measure from the center of the ball. Right? And then I have my O2 flow according to the Kenya Comprehensive Newborn Care Protocols set at 3 liters per minute. Right? So I have 6 right here, I have 3 right here, and then the protocols also state to have 6 centimeters of water in here to maintain a pressure of 6 centimeters of H2O in our overall circuit. So as you can see, there's no bubbling going on right now, but if we were to attach this to a patient or if we were to test it by pinching these nose piece prongs, then we will see bubbling in the bottle. So now we have bubbling in the bottle because it is a pressurized circuit. So that means there is 6 centimeters of H2O pressure in these tubes. Alrighty guys, a few quick reminders. I'm going to go through this relatively quickly, so feel free to pause this and read all the way through it if you would like. Increasing the oxygen flow rate is going to increase our percentage of oxygen, or our FiO2, and this can help patients with low SpO2. On the other hand, increasing the water level increases the positive end expiratory pressure, also known as the PEEP, and this can help patients with difficulty breathing, often seen in neonates as retractions or grunting. Again, make sure you follow your protocols, everything within normal limits, because again, too much pressure can be bad as well. So make sure you follow your protocols, but these are just 2 general trends that we see. Continuing on, CPAP only works on patients that are breathing on their own. Never use CPAP on apneic patients. Apneic patients need PPV with an ambu bag. They do not need CPAP because CPAP will not work on apneic patients. Next, never troubleshoot problems with the CPAP while the baby is on CPAP. Obviously, if it's not working, don't leave the patient on a therapy that's not working while you try to fix it. Put the patient on another oxygen therapy, fix the problem with the CPAP, then resume CPAP treatment once the system is functioning properly again. Next, if the patient is doing well on CPAP treatment, then rapidly becomes worse, assess for the possibility of a pneumothorax. It is possible that there was a rupture within the lung that has caused air to accumulate in the chest cavity, preventing the lungs from inflating properly and decreasing the patient's ability to breathe. Also, keep in mind the possibility of a machine malfunction. If your patient spontaneously gets worse, always keep in mind that the machine can malfunction. So you want to check to make sure your machine is functioning properly. Check all the tubing, make sure that everything is connected, ensure that the machine is functioning as it should be. Also, ensure that your oxygen source is working. It is possible that your tank has become empty if you're using an oxygen tank. Hopefully not, because you are checking it frequently and replacing it before it gets empty. But if something happened and the tank became empty, that could be a source of the problem. Also, it is possible that the oxygen concentrator failed or stopped working, so make sure you check your oxygen source and continue to assess anything else that might be a problem to try to fix whatever's going on with the patient. Obviously, if the patient rapidly becomes worse, this is an emergency, especially if it is a pneumothorax. But regardless, if the patient rapidly becomes worse, make sure you get help. Call the doctor immediately. Get help. This is an emergency. CPAP absolutely is a life-saving treatment, but we have to do it correctly. So it's important that we know how to use the machine and how to make sure that we administer the therapy properly. Okay, so now when you are in the NBU and you are monitoring a patient on CPAP, there's some important things that you want to look out for. First and foremost, the pressure of CPAP should never go above 8. So your bottle should never have more than 8 centimeters of water in it. Also, you want to make sure you are effectively positioning the cap with the clips and the nose piece on the baby. These tubes are very heavy, right? They're very heavy and they like to pull every which way, and it's hard to get it properly positioned on the patient, but it's very important because we want to, one, make sure that it's comfortable on the patient, two, not causing any harm, and three, we want to make sure that none of the tubing is like kinked, or make sure the nose piece isn't twisted or something weird like that where it's making our treatment ineffective. So you always want to make sure you use the cap provided and these clips to effectively secure this to the baby, which again requires reassessment because the babies move and things like that. So you want to make sure that this is as comfortably and effectively secured to the patient as possible. These nose pieces right here, they should not be pressed all the way up into the nose, right? They should be thoroughly in the nose, but you don't actually put this horizontal tube all the way to the septum. There's actually a little bit of a gap, enough so that these are well into the nose, but you're not actually pushing this horizontal piece all the way up towards the septum, so you're causing any sort of damage. You wouldn't want to do that. You want to make sure there's a little bit of a gap. Again, as far as nasal care goes, the comprehensive care guidelines state that you should provide nasal saline drops to the patient in order to prevent skin breakdown. So there's a lot of stuff you need to do to monitor your patient and make sure that this treatment is going well and make sure that it's not causing any sort of skin damage or breakdown. As far as red flags to be on the lookout for when you are monitoring a patient on CPAP, you want to be on the lookout for secretions, because it's especially important with CPAP. If the baby is creating secretions, the CPAP or the pressure we're pushing into the patient can actually push those secretions down into the airway, and that can obviously worsen the patient and their ability to breathe. So we want to be on the lookout for secretions and make sure we suction appropriately and only as needed, but as needed in case there are secretions. Also, you always want to make sure you're not providing too much pressure because that can cause a pneumothorax. So ensure you are following the comprehensive newborn care protocols on how much flow rate you should have, what your oxygen percentage should be, and what your overall pressure should be. Additionally, a patient on CPAP should have an OG tube in place, because another thing you need to look out for is gastric distension. Because we're pushing air into our patient, that can accumulate in the stomach, causing gastric distension. And if their stomach inflates, that can put pressure in the chest cavity, preventing the lungs from inflating as much. It can also cause vomiting. So we want to make sure we're not putting too much air into the tummy or the stomach of the patient, because that can cause other problems. So the patient on CPAP should always have an OG tube in place with a syringe attached to it with the plunger out so that the OG tube can vent. Again, there's way more things that we want to be on the lookout for CPAP. I'm not going to go through them all right here because you have the comprehensive newborn care protocol and you all can go through that. So please take the time, go through all the things to know about CPAP in the comprehensive newborn care protocols, all the things to look out for, the red flags. Look up the indications for CPAP, the contraindications for CPAP. Be sure to have the comprehensive newborn care protocols opened and follow them when you are using this machine. It is absolutely critical. This is a machine that can save lives, but you can also cause harm to your patient if you do this incorrectly. So be sure you follow the comprehensive newborn care protocols on how to use and administer and monitor CPAP. You guys are not going to be the ones prescribing and starting the CPAP treatment for the patient. That's going to be a higher level medical professional that does that, but it's absolutely your job to monitor. And because you are in here and you are learning to one day be managing care, you should know the indications and contraindications of CPAP. So make sure you review those and know why we use it, but also why we can't use it in certain patients. All right, guys, that's a quick overview on CPAP. Again, please continue to explore and learn more about it. See you in the next one.